Hi, I'm Dr. Paul Rossignol. I'm a doctor of Oriental Medicine in Albuquerque, New Mexico, and I'm also the campus director here at Southwest Acupuncture College in Santa Fe, New Mexico. We're going to talk a little bit today about Gua Sha Therapy, which is one of the adjunct therapies that's included as part of traditional Chinese medicine and taught as part of our curriculum here at Southwest Acupuncture College. Gua Sha method is an ancient Chinese medical technique. It involves a frictive therapy that's supposed to cause local redness or small petechia. And there's actually multiple methods that they utilize to obtain that effect, which include things like slapping techniques they call pak sha in Chinese, or pinching techniques, nie fa, or the one that we'll talk about today, which is probably the most commonly applied method, which is the Gua Sha or scraping method to a frictive technique. The scraping method is utilized usually some kind of a ceramic or stone implement. This is a ceramic soup spoon. The main things in terms of the method, the tools that they're using is you want something that has a smooth edge on it so it's not going to harm someone's skin when you're applying scraping technique to the skin. Also, it's good to have something that's a non-porous material, like metal or a smooth stone like jade or something like that, or like a finished sealed ceramic or plastic or something like that, but something that's non-porous so that it can be appropriately disinfected after use and reduces the chance of infection. So we're going to demonstrate the Sha, the scraping method today. It's important in terms of preparing for Gua Sha treatment is making sure that you've got a appropriate medium. Usually, some kind of an oil or a solve to provide a little bit of lubrication for the scraping method in Gua Sha. We're going to be applying Gua Sha for the posterior aspect of the body and the shoulders and back. That's probably the most typical place where they'll apply Gua Sha, and for general conditions like pain and also relieving fevers and things like that. Really, Gua Sha is most typically applied to kind of like the posterior aspect or the lateral aspect, or what we call yang aspect of the body. One of the things that we'll look for when we do our exam is whether or not we're seeing what they call signs of Sha. So what they'll do is they'll actually put a little bit of pressure, and you'll notice the skin will blanch a little bit under my fingers when I press down. What we're looking for there is to see how long it takes for that blanched skin to kind of pink up again after under my fingers. Hers actually pinks up relatively well. If it were to stay a little bit more white, let's see if there's an area on her back where maybe it stays white a little bit longer, where that blanching doesn't pink up quite as fast, so maybe a little slower on the left side actually. So if we're not seeing it pink up quite as fast, that's an indication that we need to mobilize some circulation or clear some sedimentation or Sha. They associate that with in Chinese medicine. Technique to apply a little bit of this medium to her skin, making sure that there's no broken skin or rashes or cuts or anything like that. So I'll show you guys a little bit of more modern technique first, which is utilizing some slower, deeper pressure, kind of break up adhesions and mobilize tissue a little below the surface. This is similar in practice to what they talk about as like modern Graston techniques or assisted deep tissue massage, utilizing a device. So again, we could apply that also over the limbs if we wanted to, if she had some soreness or pain of the limb, and I found, maybe found under palpation adhesions or hypertonicity. And again, relatively deeper pressure, relatively slower. More traditional, what we'd think of as kind of like effusive Gua Sha treatment, so make sure we got plenty of medium in the area that we're going to apply it to. Then we'll grip the tool tightly, and usually we're going to move from the center of the body outward. So again, it's like you're trying to move things from the interior, from the inside towards the surface is the idea. And then often we're going to use kind of quick brush strokes. The way I was taught was that you're kind of digging in and coming back out again, that idea of kind of from the deeper level towards the surface. And you'll notice this is a little bit quicker, a little brisker motion. I'm still putting some pressure on it, but maybe not as deep pressure as I was with the slower movement. And you'll notice as we do this, this starts to bring up a little bit of what they call therapeutic petechia to the surface. It's important when you're doing Gua Sha to discuss with patients the fact that you are going to see some redness and some petechia with this treatment, and that may actually persist for a few days, may look red or purple for a few days. Okay. And then traditionally what they'll actually do is you'll continue this treatment until you can't really raise any more red. Which we're kind of at that point now. The other side, just want to make sure that we kind of evenly treat both sides so that she feels relatively balanced. Cover her shoulder a little bit more, since I can see as I'm going over that area, it's raising a little bit of Sha, a little bit more of that petechia, so that indicates it needs to be treated a little bit more too. I'll make sure, of course, to wipe the oil off my hands, and then wipe my hands and wipe some of that oil off her before. One of the other things that you'll sometimes see practitioners do is following Gua Sha, they'll actually apply some warming therapy, usually either with moxibustion, which is that burning mugwort floss, or sometimes they might have other mechanical warmers or warm packs that they might apply over the area.